Clinical studies have demonstrated the importance of the dressing for IV site protection and wound healing. Semi-permeable, transparent dressings were designed to simulate the natural protective qualities of healthy, intact skin. These dressings breathe while providing a barrier to contaminants. Semi-permeable film provides a sterile barrier, impervious to liquids, viruses, and bacteria, to help prevent contamination of the site. The breathability of the film allows oxygen in and moisture vapor out so the skin can function normally. Also, the film moves flexibly with a patient's skin, increasing comfort. The transparency of the film allows the site to be monitored for early signs of complications without changing the dressing. Fewer dressing changes reduces the risk of site contamination and skin breakdown, while saving nursing time and costs. 3M's full line of Tegaderm transparent dressings offers a broad array of choices for effectively managing wounds and IV sites. There are more clinical trials supporting the safe and cost-effective use of Tegaderm products than any other brand of transparent dressings. Tegaderm products provide all the benefits of a transparent dressing: breathability, a barrier against contamination, site visibility, reduced risk of site contamination and skin breakdown, cost-effectiveness, and patient comfort. Tegaderm products are available in many shapes and sizes. Tegaderm dressings employ the picture frame delivery system, preferred by clinicians for easy handling and proper application. Tegaderm dressings can be used over a variety of IV catheter sites, including peripheral catheters, central IV catheters placed in subclavian, jugular, or femoral veins, and peripherally inserted central catheters. Tegaderm dressings can also be used over ports or tunneled catheter exit sites, and insertion sites for other devices, such as epidural catheters, dialysis catheters, insulin-pumped needles, cardiac catheters, and feeding tubes. The Tegaderm dressing product line offers specially designed shapes, some with sterile strips included, to make challenging sites easier to dress and more secure. The adhesive surface and conformable film of Tegaderm dressings help IV lines and other devices stay secure. Avoiding unnecessary dressing changes or line restarts can greatly improve the cost-effectiveness of site care protocols. Tegaderm dressings are commonly used over wounds, including clean, closed surgical incisions, stage 1 or 2 pressure ulcers, superficial wounds like abrasions, skin tears, and blisters, skin graft donor sites, first and second degree burns, and to facilitate autolytic debridement. They're also used for protecting sites at risk of skin breakdown. Tegaderm products can be used alone or as a secondary dressing over gauze, alginates, or hydrogels. The conformability and specially designed shapes of Tegaderm dressings provide easy placement and secure adhesion, even in difficult-to-dress areas. The breathability of Tegaderm products fosters the optimum setting for wound healing. Natural wound fluid can be maintained at the site, while excess fluid can evaporate off. The transparency of a Tegaderm dressing allows easy monitoring of the wound site without removing the dressing. This helps avoid unnecessary interruptions to the healing process, reduces the risk of contamination, and improves patient comfort. Transparent dressings can be safely left on wounds for up to 7 days. Internationally recognized guidelines for IV therapy support the use of extended wear times for transparent dressings compared to gauze dressings. According to these guidelines, transparent dressings can be left in place for the duration of catheterization on peripheral IVs and for 7 days on central venous catheters. These wear times are considerably longer than the guidelines for gauze dressings. Fewer dressing changes and increased wear time save costs and valuable nursing time. Numerous clinical trials by independent researchers support the use of Tegaderm transparent dressings for both wound and IV site applications. Dr. Dennis Mackey is a leading researcher on infection control and IV therapy.
We have two options for dressings, and dressings should be sterile. We can use sterile gauze and tape, or we can use a commercial transparent film dressing. The question was raised, are these dressings safe? Fortunately, we've got some data on this question.
Dr. Mackey's study of over 2,000 peripheral IV catheters demonstrated the safety and cost-effectiveness of Tegaderm dressings when left in place for the duration of catheterization.
What we found was a very low rate of catheter colonization and no bacteremias in any of the groups. This study tells us that transparent dressings are safe and as effective as gauze and do not need to be replaced every 2 days.
There's also a considerable amount of research on the use of transparent dressings for central catheters.
This is a pooled or meta-analysis of the 7 large prospective trials of transparent dressings compared with gauze on central catheters. And the sum total, there are no differences in the risk of infection.
Various wound studies have also demonstrated the importance of transparent dressings for rapid healing and protection of the wound from outside contamination. Reprints of these studies are available through your 3M representative. When selecting a Tegaderm transparent dressing, choose the size that will adequately cover the catheter and exit site, or the wound being dressed. Prepare the catheter insertion site or wound according to your institution's protocol. To ensure good adhesion, clip excess hair, but do not shave. Shaving may cause abrasions, allowing bacterial invasion of the skin. The skin must be free of soaps, detergents, and lotions. Be sure all preps and protectants are dry before applying the dressing. Wet preps and soap residues can cause irritation if trapped under the dressing. Also, adhesives don't adhere well to wet or oily surfaces. Do not stretch the dressing during application. This applies tension to the skin, which may result in mechanical trauma. The adhesive of Tegaderm dressings is pressure sensitive. To ensure the best adhesion, press the dressing into place. Then slowly remove the frame, securing the dressing edge as you go. Gently pinch the dressing around the catheter or other device to form a seal. Finally, smooth the dressing down by pressing firmly from the center out to the edge. When removing a Tegaderm dressing, support the skin around the site and stabilize the IV to prevent dislodgement. Grasp the edge of the dressing. Slowly peel it from the site. Peel the dressing back, low to the skin. Do not pull up on the dressing. That may cause skin trauma. You may also remove the dressing by gently stretching the film. Either method allows for comfortable removal. Following the procedures you've seen in this video will help your patients, your institution, and you get the maximum benefit from 3M Tegaderm transparent dressings. Please join us for the next module of this in-service training series. We'll demonstrate effective use of 3M Tegaderm transparent dressings for central IVs.